I'm from speech therapy, and I am going to talk through why a patient would need speech therapy and how that would affect you going onto the floors and treating a patient to feed them and take care of their nutrition. When speech is ordered, maybe a patient has a stroke or they're suspected for pneumonia, they would call speech and we would come and do an assessment of their swallow. We would then make some recommendations. In a patient's room, we will post these beautiful yellow sheets that will tell patients diet consistency and their liquid consistency based on what we recommend. There are multiple different diet consistencies that we would recommend. There's a regular diet, which there's no restrictions to this diet. A mechanical soft diet is similar to a regular diet, but the food is a little bit softer, like it sounds. We eliminate hard veggies, harder, chewier meats. We have two versions of a mechanical soft diet: chopped meats and ground meats. They come exactly as they sound. And then a pureed diet sounds like it is, looks like baby food. And we might alter someone's diet consistency due to poor dentition, or because maybe they have a cognitive component and they do not know how to chew solid food. So we want to be able to make sure they can eat just in an appropriate manner. Another thing we will alter is a liquid consistency. Sometimes thin liquids are not safe for patients to swallow if they go into their lungs, so we would alter them. And we have 3 different types of liquid consistencies. Thin liquids are just what we drink every day: our sodas, our pops, our waters. We have a next thick is nectar thick liquids. So this is a little bit thicker. It comes off the spoon a little bit slower. Our thickest liquid that we will recommend is a honey thick liquid. So again, it comes off slower, a little more clumpy. If you are treating a patient that is on a thickened liquid diet, we want to make sure that they are always consuming those liquids, because a thinner liquid may not be safe. On the floors, there are different cups, and we want to make sure that when you're giving patients water throughout the day to make sure they stay hydrated, that you are thickening them appropriately. There's big cups on all the floors, along with these cans of thickeners. We made a little cheat sheet so that it's easy to thicken liquids, and you don't have to say, oh, what did I have to mix it up with, if this is already there for you. In the big cups, 4 big scoops of the scooper that's already in there for nectar thick, so 4 for nectar, 5 for honey. Put your water in, put your thickener in, stir it really good, give it time, because this thickens over time, and it's easy to think, oh, this doesn't look thick enough, and add, well, that will over thicken it. So just give it time, stir it a little bit more, and if you follow this cheat sheet, you'll be perfect. The rest of this yellow sheet just is recommendations on how we would recommend that you would feed the patient. On this yellow sheet, it'll say a 1-to-1 feeder, periodic mealtime supervision, or self-feed. That gives you a clue into how we are recommending they're getting fed. 1-to-1 just means that they need help with all of their feeding, their drinking, and their eating. So that means you will be feeding them. Periodic mealtime supervision just means checking in on them, maybe setting up their meals at the beginning. Self-feed means the patient's completely independent. And as we would say for like a 1-to-1 feeder, just think about how you would feed yourself or a loved one. That's how you should feed that patient. We will have recommendations like using a slow rate, small bites, small sips, making sure that patient is positioned upright. If your sheet says alternate bites and sips, that's just doing it as it says. Give them a bite, give them a sip. We're just wanting to make sure that if the patient has residue in their mouth, that gets cleared out. We don't want it sitting in their mouth. We will also recommend for the nurses how patient is given their meds, so you may not have to worry about that, but that will be located on the sheet. We will also may say check the mouth for food. Again, sometimes patients pocket food in the sides of the mouth. Just have them open up, take a look inside, make sure that there's nothing there. If there is, give them a drink of water, clear that out. Say a patient doesn't follow directions, a pro tip is to use a spoon with no food, no water on it, put it up to their mouth, and that makes the patient think they're gonna get food, and they'll open their mouth for that. If you see like a swallow twice, that could just be a verbal cue. Hey, there's still food in your mouth, go ahead and swallow that. Chin tuck might be on the sheet. That's not always appropriate, but if you do see that, that's asking the patient to put their chin to their chest and to swallow the food from that position. That just helps with airway protection. Another thing that we might put is allow time for swallow. Sometimes patients just need more time to chew, more time to get the food down, and just give them time. On the last part of the sheet just says aspiration precautions. If you're ever with a patient, you're feeding them, you walk by their room and they're coughing or having a hard time swallowing, we recommend that you take that food away, let the nurse know, and speech will come and check that patient. That's all I have. You can contact the speech therapy department if you have any questions. Thank you.